Welcome. Today we're diving into the world of Wilson's disease, a rare genetic disorder that can severely impact the nervous system and liver. Join us as we unravel the complexities of this condition, from its origins to its management, and explore the ongoing research offering hope for the future. So, what causes Wilson's disease? It all boils down to a faulty gene called ATP7B. This gene provides the instructions for making a protein that transports copper out of the liver and into bile for excretion. When AT7B is mutated, the body can't effectively get rid of excess copper. This inherited condition means that if both parents carry the defective gene, there's a 25% chance their child will develop Wilson's disease. Now, let's delve into the pathophysiology, or how Wilson's disease actually damages the body. Because the mutated ATP7B protein can't function correctly, copper builds up, primarily in the liver and the brain. This copper accumulation acts like a toxin. In the liver, it leads to inflammation, cell damage, and eventually cirrhosis. In the brain, particularly in the basal ganglia, it disrupts normal neurological function, leading to a wide array of neurological and psychiatric symptoms. Wilson's disease is a rare condition, affecting approximately 1 in 30,000 people worldwide. It's found across all ethnic groups and geographical regions, although prevalence may vary slightly depending on population genetics. Early diagnosis is crucial to prevent serious long-term damage, which is why understanding the symptoms is so important. The signs and symptoms of Wilson's disease are incredibly varied, and they often depend on which organ is most affected by the copper buildup. Liver-related symptoms can include jaundice, fatigue, abdominal pain, and swelling of the legs or abdomen. Neurological symptoms can manifest as tremors, muscle stiffness, difficulty with speech or swallowing, and problems with coordination. Psychiatric symptoms like depression, anxiety, and personality changes are also common. A characteristic sign, although not always present, is Kayser-Fleischer rings, brownish rings seen in the cornea of the eye due to copper deposits. Diagnosing Wilson's disease can be challenging due to its diverse symptoms and the rarity of the condition. Doctors typically use a combination of tests, including blood and urine tests, to measure copper levels in ceruloplasmin, a copper-carrying protein in the blood. Liver biopsies can assess liver damage and copper concentration. Neurological examinations and brain scans such as MRI help evaluate brain involvement. Genetic testing can confirm the presence of the ATP7B gene mutation. The presence of Kayser-Fleischer rings, while not always present, is a strong indicator. While there aren't distinct types of Wilson's disease in the traditional sense, the disease can present with predominantly liver-related symptoms, predominantly neurological symptoms, or a mix of both. The age of onset and the severity of symptoms can also vary significantly from person to person. Fortunately, Wilson's disease is treatable. The primary goal of treatment is to reduce copper levels in the body and prevent further accumulation. This is typically achieved with medications called chelating agents, such as penicillamine and trientine, which bind to copper and help the body eliminate it through urine. Zinc supplements can also be used to block copper absorption in the gut. In severe cases of liver failure, a liver transplant may be necessary. Lifelong monitoring and adherence to medication are crucial for managing the disease effectively. As Wilson's disease is a genetic disorder, there's no way to prevent the underlying gene mutation. However, genetic counseling is highly recommended for individuals with a family history of the disease. This counseling can help families understand the risk of passing the gene on to their children and explore options like prenatal testing. The prognosis for individuals with Wilson's disease is generally good with early diagnosis and treatment. Consistent adherence to medication and regular monitoring are key to preventing complications and maintaining a good quality of life. Untreated, Wilson's disease can be fatal due to liver failure or severe neurological damage. Ongoing research is focused on developing new and improved therapies, including gene therapy, which holds promise for a potential cure in the future. Researchers are also working to better understand the mechanisms of copper toxicity and identify biomarkers for early diagnosis. The future looks brighter than ever for individuals affected by Wilson's disease, as advancements in research continue to improve outcomes and offer hope for a cure.